Dr. John Kruse, a renowned psychiatrist specializing in ADHD treatment, shares his expertise on managing ADHD symptoms. He explains that ADHD is a complex condition with 18 different symptoms, divided into hyperactive, impulsive, and inattentive categories. While the hyperactivity component is often associated with ADHD, it's not always present. In fact, some people with ADHD may not exhibit hyperactivity at all. Kruse emphasizes that ADHD is not just a childhood disorder, as previously thought. Many adults struggle with ADHD symptoms, which can fluctuate over time. He notes that the heritability factor for ADHD is around 0.8, indicating a strong genetic component. However, environmental factors also play a significant role in shaping ADHD symptoms. Kruse suggests that people with ADHD often struggle with executive functions, such as working memory, selective attention, and emotional regulation. As a result, they may rely more heavily on external structure to stay organized and focused. This is why working from home or in an unstructured environment can exacerbate ADHD symptoms. Kruse believes that the COVID-19 pandemic has contributed to an increase in ADHD diagnoses and prescriptions. With the shift to remote work and reduced structure, many people with ADHD have found it more challenging to manage their symptoms. Additionally, the increased demands of working from home, such as managing childcare and household responsibilities, have further complicated this situation. Kruse also touches on the importance of optimal structure in managing ADHD symptoms. While too little structure can lead to distraction and disorganization, too much structure can be stifling. He notes that people with ADHD often thrive in environments that offer a balance between structure and flexibility. Kruse's insights highlight the complex interplay between biology, environment, and lifestyle in shaping ADHD symptoms. By understanding these factors, individuals with ADHD can develop strategies to manage their symptoms and thrive in their personal and professional lives. Unlike non-ADHD brains, which are driven by importance, ADHD brains are more focused on what's interesting to them. This can affect their career choices and work habits, as they may struggle to stay engaged in tasks that aren't compelling to them. Kruse emphasized that it's essential for people with ADHD to find careers that are interesting to them, as it will make it easier for them to work at it. Kruse discussed how society's values have changed, and the idea of having one long-term career is no longer the only option. Many people with ADHD may thrive in careers that involve multiple short-term projects or changing roles. This is because their brains are wired to respond to novelty and variety. The conversation turned to the topic of social media and its impact on attention. Kruse explained that excessive social media use can lead to a decrease in attention span and an increase in distractibility. This is because social media platforms are designed to be attention-grabbing and interruptive, which can train the brain to overreact to distractions. Kruse also discussed the importance of optimal structure in managing ADHD symptoms. He notes that people with ADHD often thrive in environments that offer a balance between structure and flexibility. He mentions the creative arts, such as acting or music, as examples of professions that can be well suited for individuals with ADHD. Kruse's insights highlight the complex interplay between biology, environment, and lifestyle in shaping ADHD symptoms. By understanding these factors, individuals with ADHD can develop strategies to manage their symptoms and thrive in their personal and professional lives. The conversation then turned to the topic of ADHD and its impact on lifespan. Kruse explained that people with ADHD have a shorter life expectancy, with an average of 10 years less than their non-ADHD peers. This is due to a combination of factors, including accidents, addiction, and suicide. Kruse emphasized that ADHD is a serious condition that can have significant impacts on a person's life, including their education, social relationships, and earning potential. However, with the right treatment and support, individuals with ADHD can manage their symptoms and thrive. The conversation then turned to the topic of hyperfocus, a state of intense focus that people with ADHD often experience. Kruse explained that hyperfocus is not just about enjoyment or bliss, but rather about being engaged in a task that is challenging and interesting. Kruse also discussed the importance of finding the right conditions for hyperfocus. He notes that people with ADHD may need to find situational factors that help them get into a state of hyperfocus, such as working in a quiet environment or using music to block out distractions. The conversation then turned to the topic of scheduling and routine. Kruse emphasized the importance of creating a routine that works for individuals with ADHD. He notes that people with ADHD often struggle with scheduling, but it's essential to create a routine that works for them. Kruse also discussed the importance of the 4 basics: sleep, eating, exercise, and relaxation. He notes that sleep is particularly critical for people with ADHD, and regularizing sleep patterns can be challenging. However, it's essential to find a routine that works, even if it's not the traditional 9-to-5 schedule. Kruse also mentioned that having a regular meal schedule is crucial, as people with ADHD often forget to eat or have trouble with interoceptive cues. He notes that time management is a significant problem for people with ADHD, and it's not just about being disorganized, but also about having trouble with executive function. The conversation then turned to the topic of ADHD and addiction. Kruse explained that people with ADHD are at a higher risk of developing substance abuse problems, with a rate that's almost double that of the general population. However, putting kids on stimulant medications for ADHD can actually protect them from this risk. The conversation then turned to the topic of medications, specifically Ritalin. Kruse explained that Ritalin is a stimulant that works by blocking the reuptake of dopamine and norepinephrine, making more of these neurotransmitters available in the brain. However, he notes that Ritalin is not as effective as amphetamine-based products, like Adderall and Vyvanse. Kruse also discussed the importance of considering all relevant studies, not just the most recent ones, when evaluating the effectiveness of a particular treatment. This is particularly relevant when it comes to fish oil, where the benefits for cardiac health and ADHD have been debated. The conversation then turned to the topic of nicotine and its potential use in managing ADHD symptoms. Kruse explained that nicotine is a stimulant that can have both arousing and anxiety-reducing effects, making it a unique substance. However, the risks associated with nicotine use, particularly when it comes to smoking and vaping, cannot be ignored. The conversation then turned to the topic of caffeine and its potential use in managing ADHD symptoms. Kruse explained that the effects of caffeine on ADHD are mixed, and that some people find that caffeine helps them focus, while others experience anxiety and jitteriness. The conversation then turned to the topic of guanfacine, a medication that works by indirectly modulating the norepinephrine system. Kruse explained that guanfacine seems to work slowly by strengthening synaptic connections in prefrontal circuitry, and it's been shown to be effective in reducing ADHD symptoms. The conversation then turned to modafinil, a medication that works by boosting activity in the orexin system, which is responsible for natural waking and arousal. Kruse explained that modafinil has been shown to improve executive functions of attention and concentration, and that it's often used off-label for ADHD and cognitive enhancement. The conversation then turned to the topic of stimulant medications for ADHD, such as Adderall and Vyvanse. Kruse explained that these medications work by blocking the reuptake of dopamine and norepinephrine, making more of these neurotransmitters available in the brain. However, he notes that there is limited evidence to support the use of these medications in adults, and that the only clear benefit is mitigating the growth suppression that can occur in children who take stimulants regularly. The conversation then turned to the topic of behavioral tools for ADHD, such as cognitive behavioral therapy, CBT. Kruse explained that CBT is an effective approach that can help with symptomatic reduction, and that it focuses on actions, thoughts, and feelings. The conversation then turned to the topic of video games and their potential use in managing ADHD symptoms. Kruse explained that there are some video games that have been FDA approved for use in ADHD, but the data on their effectiveness is limited. The conversation then turned to the topic of social media and its impact on ADHD symptoms. Kruse explained that excessive social media use can lead to a decrease in attention span and an increase in distractibility, and that it's essential to find ways to limit social media use. The conversation then turned to the topic of circadian rhythms and their potential impact on ADHD symptoms. Kruse explained that some research suggests that bright light therapy can improve ADHD symptoms by resynchronizing internal rhythms. The conversation was a deep dive into the complexities of ADHD, covering various aspects of the condition, including medication, behavioral tools, and neuroscience. Kruse's expertise in the field was evident throughout the conversation, and his ability to explain complex concepts in a clear and concise manner was impressive. Main learning from video. The discussion highlights the complexity of ADHD, a condition with 18 symptoms divided into hyperactive, impulsive, and inattentive categories. Dr. Kruse emphasizes that ADHD is not just a childhood disorder, and many adults struggle with symptoms that can fluctuate over time. He notes that people with ADHD often rely on external structure to stay organized and focused, which can be challenging in unstructured environments, like working from home. The conversation also touches on the importance of optimal structure, finding careers that are interesting, and the impact of social media on attention. Dr. Kruse shares his insights on managing ADHD symptoms, including the use of behavioral tools like cyclic sighing, exercise, and medication. He emphasizes the importance of understanding the brain's chemistry and finding the right balance between structure and flexibility. The discussion also covers the relationship between ADHD and addiction, the benefits of fish oil, and the importance of a holistic approach to managing ADHD. Key takeaways include the need to understand the complexities of ADHD, the importance of finding the right balance between structure and flexibility, and the value of behavioral tools and medication in managing symptoms. By adopting these strategies, individuals with ADHD can improve their focus and reduce the risk of addiction and other problems associated with the condition. To access the complete 24-minute summary and unlock detailed insights for each topic discussed in the video, please subscribe to Quick Podcast Summaries on Spotify and Apple Podcasts with free trial, and later, just for the price of candy in most places. Happy listening, go. Habringhausians und dabei, Tosio, 9, October, Adult Rare, to Selective.